Hey, everybody. So I was a few minutes late because I don't know, my computer just wouldn't find my camera for a minute, and so I had to completely reboot. But we are here and rocking and rolling and ready to have this conversation. So I'll give it just a minute for folks to get in here. Lots to talk about because I haven't done a live since Friday that I know of. Hey, Alicia, how are you? So there's a lot to cover and to talk about. Today's been a very eventful day in my world and in the ballad world. so we're going to kind of take this piece by piece. Hey, Amber. Hey, Terry, how are you, love? Hey, Martha. How is everybody? Hey, Heather. Good evening, Patricia. Hey, Lori. So I'll kind of give it a second, let folks, do I know who the board of directors are? Yes, I do know who the board of directors are. It's listed on the Ballad website. Hey, Daryl, how are you? So, I do know who the board of directors are. Hey, Kathy. Hey, Jeff, how are you? Hey, Gail. I am feeling a lot better, thank goodness. So yeah, you would not have wanted to see me over the weekend. It was literally like a bloody, runny, snotty nose, sneezing. All of that really great, attractive, not so very attractive stuff. So what's up, Sean? Hey, Jamie. Hey, Tanya. Hey, Jessica. Okay, so I'm going to stop. Hey, what's up, Blue? I'm going to stop like greeting everybody now and let's get down to business. So here's what I will tell you is I'm going to be giving out new contacts, new telephone numbers, new things that I've discovered today. So you do want to make sure that you share this live because there's going to be actionable items that I will share with you. And as always, when I'm done with this live, I will go up to the top and I will post that information in there. No, Patricia, I didn't go anywhere near a Ballad hospital or urgent care or ER when I was under the weather. So no, none of that good stuff. So, you know, who can blame you, right? Kind of self-preservation and all of that yummy goodness. So, thank you, Scotty. Me too. Me too. It was yucky for a minute. So I want to dig into this and kind of talk about a few things. So I want to go ahead and I'm going to address the last post that I put up today about Gary Miller. He and I, we did have a very lengthy conversation today. And here's what I'm going to be sharing and not sharing from that conversation is because he and I had what I hope was a very authentic conversation. There were things that we were able to express to each other that I feel like, you know, not all of it needs to be shared, and we'll just kind of see where it goes. It's literally the first really rational, understanding, two-way conversation, even respectfully disagree. You know, it was a good conversation. So, you know, there were things that, you know, he was able to say, you know, well, I made some good points and things like that. And so we were able to have that conversation, and I want to keep that there. You know what I mean? It was the first one. I will say this. He has also agreed, because he was not originally included in my meeting with Ballad Health that is scheduled for December 13th. And he has agreed to be a part of that meeting and for me to come, you know, with a list of questions that I have. And, you know, and we all know that I have quite a few. So I'm going to leave that where it is. So I will say this. There were things that we disagreed on. There were things that that I vehemently disagreed on. But it was a very respectful conversation, and he listened. And so I have to give him credit for that. So what I won't do is be pessimistic about it and say, well, that's because, you know, you talked to the governor's office today and blah, 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 blah. Like, I'm not doing that. Here's the thing, folks. We have to be looking at what is the end game, right? What is the end game for what's going on? And so we have to look at, you know, is it completely undoing this entire merger? And if so, what does that look like? Is it getting some compromise in some areas and finding a way to be able to work together and be able to develop public trust and relationship and all of that, and still be okay with the fact that it's a severe medical monopoly. Those are things that I don't believe we're going to get an answer to today, right? We've been at this like not even quite 3 weeks. So there's going to be work involved and conversation that needs to happen. And so I will say this, I was grateful for that dialogue today, and I'm just going to pocket that right over there and leave it where it may be. Now, what I will tell you is he did mention that you all have been calling him like I suggested. So keep doing that and keep emailing and filing the online COPA complaints. Right, Jamie. It wasn't just a one-sided conversation. So I was very happy about that. Hey, Hera. Hey, Jamie, and Deb. And Bridget. So I want to keep going and talking about all this. So I started my day off with an agenda. I finished my workout this morning and really wanted to dig into, you're very welcome, Loretta, and really figure out, okay, so where are the areas that we have some room? Where are some areas that maybe we can get a little leverage and really begin to bring in some outside sources and outside powers that be? Because I do have concerns about the state's ability to properly oversee this COPA, and I have that concern based on several different things. So I'm just going to run through some of these things for those of you guys who haven't been on all of the lives or need to be caught up to date. So for those of you who do not know, Ballad Health is the result of a merger between Wellmont Health System and Mountain States Health Alliance, and they went through the process of applying for a COPA. The FTC vehemently disapproved that COPA, and all of those different things. And at the end of the day, here's the result. The result is the COPA got passed. Now, there are certain pieces of this where, I have followed the money and found certain politicians who are benefiting monetarily from either a direct contract, paid employee status with Ballad Health, or their spouses are, and so forth and so on. So that concerns me because here's what I will know. Hey, Allison, I do want to pull up something for you guys. So I want to pull up, you guys have heard me talk about these independent investigations and looks at this merger and whether or not people felt like they should or should not take place. And one of them that I have never shared with you before, I want to give you just a piece of it now, if you don't mind. So you guys have heard me talk about what the FTC said. You have heard me talk about what Robert Townsend, who the Commonwealth of Virginia hired Robert Townsend to do an independent investigation on this merger and give his assessment. They actually paid him $800 an hour to do so, and he did. And his outlook was the same as pretty much everybody that wasn't paid by Ballad. The only outside independent investigation or look at this merger that was for Ballad was paid for by Ballad, and it was a company called Compass. But I want to read this to you guys. So for those of you all who say, oh, I'm just spewing things that aren't true and that I'm not giving you anything factual, I want you all to understand that this isn't Dani saying this merger was a bad idea, right? This was legitimate people with years and years. Like the guy that I'm getting ready to talk about right now is the Commonwealth of Virginia. He put it in his report, Mary. You can get it online. But here's the thing. So this guy is like from Stanford University. He was like one of the top 100 most powerful people in healthcare. Like all of his certifications and degrees and all of that are extensive. But let me just give you the opening 2 paragraphs about this merger. So you guys have heard Ballad give these presentations, and you have heard Ballad say, these are the things that we plan to do. We're going to spend X number of dollars to do this and to do that and to do this. But what you don't hear is a definitive plan on how these things are going to occur. You hear, oh, we're going to do A, B, C, D, X, Y, Z, but you don't see any detail in that, right? It kind of reminds me of politicians who say, oh, well, we're gonna solve healthcare, but yet you don't hear shit about their healthcare plan. That's kind of the way that Ballad presented things. And I want to share this paragraph with you guys so that you can hear it. This is Kenneth Kaiser. And so check this out. This is what he says. And one of the things that I'm going to ask you guys to do, right? One of the things I'm going to ask you to do, because sometimes people take information from this live, and because they are so busy already thinking ahead of what I'm going to say, sometimes people mishear the information. So what I'm going to ask you to do is be attentive, pay attention. Don't listen for what you want to hear. Listen for what I'm telling you, and listen for accuracy and not emotion, okay? Because here's the thing. At the end of the day, we have a merger that is here. And we have to figure out either how we can get some compromise and some common ground with what we have while we try to fix it, right? Or, you know, it's just going to be tit for tat, and nothing changes. So I need us to understand that I want to stay with the pressure on, right? I want to keep our foot on their neck, but I also want us to understand that at the end of the day, there has to be some sort of cooperation that happens between us and everyone else, okay? So I said the reason why I shared how much they paid him is that this is somebody that the Commonwealth of Virginia invested money in to find out if this was one thing, that something that needed to happen for the people. So listen to me. This is just 2 small paragraphs from this other independent investigation by Kenneth Kaiser. And this is what he says. This is under general assessment findings and conclusions. After carefully reviewing and considering the application and other publicly available materials, I find there to be a pronounced paucity of detail and lack of specificity about how the claimed benefits will be achieved. In fact, the application is generally so vague about the means and mechanisms by which purported benefits will be achieved that it is impossible to determine whether they are plausible. As a result, I do not find them credible. That is, many of the claims of efficiencies and savings, improved access and quality of care, and better population health lack credibility because the parties have not provided a reasonable explanation for how the claimed benefits will be accomplished. Providing specific and detailed descriptions and plans about how the quality and efficiency improvements will be accomplished is necessary to judge whether the projected outcomes and operational savings are realistic and to determine whether the merger per se is required to achieve the claimed benefits. Based on the information the parties have presented, it appears that many, if not all, of the outcomes claimed as benefits of this merger could be achieved in other ways. This is the same verbiage. This is along the same verbiage that every independent investigation of this merger came up with, right? And this is what the FTC said. So I will absolutely post a link for this. Everything that I've pulled so far, guys, has been from online. But here's what I need you all to understand. This is the no, this is actually, no, Alicia, this is before that. So listen, this is before, listen guys, this is before this merger was approved. This is before SB 2048. This is in the very beginning. They applied for a COPA. The state of Tennessee and the Commonwealth of Virginia paid for independent assessments. Matter of fact, wait a minute, let me back up and not say the state of Tennessee. The FTC is who paid for the one that I just read to you. So listen, I'm going to post the link. I'm not going to answer like a lot about his background because it's huge. And so I want you all to stay with me and hear what I'm saying. Hey, Nina Boo. Okay, so listen, one of the reasons why this is important to me is because I had a conversation today with, and he hates me now, I'm sure, with a gentleman by the name of Bill Durden. Okay. And no, the Kaiser guy is not friends of Kilgore. Kilgore was for this merger. This guy was not. Guys, this is where I really want y'all to kind of stay with me. Stay with me and listen to the facts because these are things that are important and that are relevant. So today I called Senator Rowe's office. And if you all remember, I talked about the fact that Senator Rowe took $8,200 in campaign contributions from Alan Levine over the course of 2012, 2014, and 2016. I believe those are the years. It's either 12, 14, 16 or 14, 16, 18, whatever. Over $8,000, okay? So one of the things that I, because people started saying, oh, you should reach out to Senator Rowe. You should reach out to Rowe. And so then I found the campaign contributions. And so I called his office today and I spoke with Bill Durden. And here's what he said to me. He said that, that Phil Rowe is neutral and has always been neutral when it comes to this merger, and that this is a state issue, and that until the federal government, whether that be the FTC or the DOJ, gets involved, he's going to remain neutral. And this was my response. I said, well, you know what, Bill? I don't really think that that's okay. Neutral is not the position that I expect for an elected representative for the people to take. I expect for you to take the position that represents the people. And by the way, this was not always a state-regulated issue. The FTC was involved for several years, investigating, speaking out, giving reports, and saying this was a bad idea. So where was Phil Rowe at that point in time? Thank you, Representative Rowe. Thank you. You know, I've called so many senators and representatives and so forth and so on. Thank you, Mike. So Representative Rowe. And so here's the thing that I said to him is that, listen, when the FTC, which is a federal agency, was involved, you said nothing. You know, and that's not acceptable, and that's not okay. And so what needs to happen at this point in time is, when we can't rely on the state to regulate, to oversee, to be impartial, to be unbiased, it is your job as a representative for the people in this state to advocate and to promote, to get the federal agencies back involved in order to protect the people. And when I said that, Bill got very, very quiet, and he kind of, you know, told me that I needed to call DC. And I said, well, I called DC last week. They never called me back, blah, 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 whatever. And then this is what I finally said to him. I said, listen, because he just got quiet. He had no response for me. And I said, here's the thing. I don't mean, I know that this is uncomfortable for you, and I don't mean to sound aggressive, but you need to understand my passion. My passion is for the people, and that should be the passion for Phil Rowe, because he was elected by the people, and his sole interest should not be his friend Alan Levine. His sole interest should not be being neutral. I mean, like saying to me that you want to wait for the federal agencies to get back involved. Well, at that point, what do we need you for, sir? If the people have to fight this fight on their own, what good are you? Why did we elect you? Why are you even part of this process? You could just have several seats and get out the way so the people who are passionate about this and who want to protect people can actually get the job done. So that's where that landed. And that's what caused me to go back and really start to look at just how much information was available before we got where we are. Because there was a lot. Everyone said, do not do this, okay? So I want to share with you some more information about Senator Rusty Crowe, because you guys have had me have this conversation. No, I haven't, Glendon. I haven't talked to Morgan Griffith in Virginia. The calls that I've made in Virginia was to the Attorney General's office. It was also to the COPA compliance officer over there. I know. So, Carla, that's why people kept telling me I needed to reach out to Rowe. They told me, that's why they said, oh, he's a doctor. This is who needs to be heard. But here's the thing. They actually said that he and Alan Levine have been friends for years now, you know. And so there you go, peas in a pod. I told you, it's like this very incestuous relationship that seems to be taking place between, you know, a lot of the people around here. So let me keep going. When we talk about Rusty Crowe, you guys know that we talked about SB 2048. Okay, so let me bring you guys up to speed and just hear me, because I'm going to give you the names of 2 additional bills after this one. So I want you all to hear me say this. Okay, so listen, stay with me, folks. Okay, okay. So here's the deal. So what we know is that on January 30th. The day before the COPA was actually issued. It was approved in September 2017, but the COPA was issued January 31st, 2018. And the day before that COPA was issued, Senator Crowe sponsored SB 2048. And this is the bill that allowed Ballad to hide behind this big wall of privacy. And I will share with you what I did say to Gary about this. I said, SB 2048 is why the public does not trust you guys. Right? So here's the thing. If you have nothing to hide, if you have the public's best interest at heart, you could have introduced a bill that allowed you to keep things like marketing strategies and business plans and, you know, in certain audits and financial audits. You could have passed a piece of legislation that allowed you to keep those things private, but did not include things like closures of facilities, repurposing of facilities, elimination of services, those types of things, even complaints, right? Those types of things that are included in this bill are what cast doubt on your intentions. When you say, you know, hey, we have the community's best interest at heart, my question is, then why do you need to hide your intentions? Why do you need to hide what you're discussing and what you're doing and only inform the public through a daggone press release when it's over and done with? That is why your credibility is shot. So like when we were discussing certain things and we were discussing certain numbers and things like that, and he said, well, what's your source? And I said, I have a lot of sources. People talk to me. Doctors, pediatricians, oncologists, OBGYN, nurses, people talk to me. You want to know why? Because people know that I have their best interests at heart, so they trust me. They, however, do not trust you, and that is your issue. So this is what I said. The bottom line is that you all have to get into a position where you begin to build trust in this community again, and I don't frankly know how you do that on the path that you're on right now, where Alan Levine can say, oh, well, this is the way things are, when this is not the way things are. No one has approved that NICU closing in Holston Valley Medical Center. So stop getting on the news and telling people that you have determined what it's going to be and it is what it is and you're not changing your mind. Well, sir, it's not your job. You don't have the final say. Like that's the truth. So this is part of the conversation that we had today. Now, things that further make me go, So remember when I talked to you guys and I told you that Senator Rusty Crowe is a contracted employee for Ballad Health. Well, I want to explain a little bit more about that. So let me tell you what. So when Tony Keck first confirmed that for me, he said that they contract with Rusty he said, Susan, he said that he understands. He did say that he does understand. Thank you, Terry, for reminding people to share. And he did see my point. Like I said, it was a good conversation. So here's the thing. So we were talking about all this, and I started to look into a little bit more of the Rusty Crowe issue, right? Because he proposed SB 2048, and I wanted to see, okay, well, how far back does he go? And I have to give one of my Facebook folks some kudos. Thank you, Crystal, because she did some digging of her own, and she was able to get some of this information from me, and then some more of it I dug on my own as well. So let me just tell you the deal. So Shared Health Services is a company that Rusty Crowe is the VP of development for. Now, from 2009 to 2011, he listed Shared Health Services as an independent source of income on his financial disclosure form, which he has to do because he's a senator, right? But here's what's interesting. In 2012, that changed. In 2012, it went from being Shared Health Services to Mountain States Health Alliance. That's where his additional income started coming from, not from Shared Health. It doesn't say both of them. It literally gets rid of Shared Health Services, even though he's listed as the VP of Development, and it gets replaced by Mountain States Health Alliance. So follow me, from 2012 to 2017, Mountain States Health Alliance has been paying Rusty Crowe. Okay, and apparently he has these wound units and things like that, and that's what's actually in their hospitals. In 2018, his financial disclosure form changed from Mountain States Health Alliance to Ballad. Okay, so I want you to understand that Rusty Crowe has been a paid contracted employee receiving income from Ballad Health from 2012 through 2018. So think about that. He's been an employee for them, and yet he passed legislation that endorsed. So remember, the first piece of legislation that he co-sponsored was Senate Bill 994. Senate Bill 994 is what amended the existing COPA law in order for Ballad to be awarded the COPA. So get this, guys, without that amendment of SB 994, right, that bill that amended existing COPA law, this merger could have never happened. Now, my understanding for the Senate ethics rules is that he is not allowed to sponsor or co-sponsor legislation in which he or his family can monetarily benefit from. Now, if you're on the payroll from Mountain States Health Alliance since 2012, how, sir, are you co-sponsoring legislation with Mark Norris and Ron Ramsey that amends existing COPA law so that their merger gets approved? I'm just wondering, that sounds like an ethics violation to me. And if that doesn't, so does SB 2048, where they get to hide all of their information, including his salary. Because see, part of SB 2048 included that Ballad Health gets to keep their pay quiet. They don't have to divulge that to the public. So Senator Rusty Crowe sponsored a bill that allowed Ballad Health to keep his income from them a secret. That sounds like an ethics violation to me. Does it not sound like it to you? It does to me. I read what Bud Holsley said. Listen, I don't want to hear anything from him. He was part, listen to me, he was part of the senators that were part of SB 994, congressman. So listen, there's House and then there's Senate. And so his name is listed on there too. It's him, Holsclaw, Eldridge, there's several of them. Okay, so can we keep going? Because that's not all. So I started to dig a little bit more, and here's what I found. So Shared Health Services, the president and CEO of Shared Health Services is a former senator by the name of David Davis. Do y'all know Dave Davis? He had one tour, is my understanding. But get this, he is the president and CEO of Shared Health Services. But guess what else? Do you remember last week, some of you guys were saying to me, we need to contact the Joint Commission because the Joint Commission accredits over 21,000 healthcare systems throughout the country. We should contact the Joint Commission. Maybe they can do something about Ballad Health. Well, get this. David Davis is a surveyor for the Joint Commission. So follow it, folks. Shared Health Services has a contract with Ballad Health to supply these wound care units in their hospitals. Rusty Crowe is the SVP, is the VP of development for Shared Health Services. David Davis is the president and CEO of Shared Health Services, and he's a surveyor for the Joint Commission. Just giving you a little extra. I swear, like, I know the South is supposed to be known for like incest and stuff, but this shit right here is too much. Here we go. Still not done. You ready? Mind blown, right, Kayla? Mind blown. All right, so going a little bit further. So I started looking at what Rusty's been doing this year since Ballad Health got their COPA issued, right? So he not only sponsored SB 2048, he actually co-sponsored. Okay, I'm gonna give y'all a chance to let's take this all in. Take it all in. Y'all ready? Okay, deep breath. Here we go. I'm gonna give you some more. So he also co-sponsored a piece of legislation called SB 2646. Now I want you guys to listen to this. SB 2646 is called the Rural Hospital Transformation Program. Now I'm going to click over, so my face might look a little funny because I'm going to click over because I want to read this to you so that you all understand just what this is. So Senate Bill 2646, which was sponsored by Watson, Crowe, Massey, Jackson, Green, Briggs, Gresham, Hensley, Potty, Reeves, and Stevens. But if you, the first two, Watson and Crowe, right? So I want to give you the summary of what this bill looks like. I cannot see your comments, so just hold them for a second. So here's what this bill requires. This bill requires that the Department of Economic and Community Development shall establish and manage a grant program to support rural hospitals in assessing viability and identifying new delivery models. Do y'all remember somebody talking about telehealth as a new way of delivering healthcare? Just follow me. In assessing viability and identifying new delivery models, strategic partnerships, and operational changes that enable the continuation of needed healthcare services in rural communities. Listen to this, though. Let me get to the yummy goodness part. The amendment number 1 defines the advisory committee for purposes of this bill as a committee convened as often as necessary by the Department of Economic and Community Development that is composed of one or more representatives from each of the following: the Department of Health, Department of Labor and Workforce Development, Bureau of TennCare, Board of Regents, and other public and private stakeholders as deemed appropriate by the department. I'm not going to read this other part, but here's the other thing. I just want to throw this last piece. The amendment number 2 on this bill says it limits the department's expenditures under this bill to $1 million and schedules this bill to expire on July 1st, 2021. So in other words, Senator Crow has co-sponsored a bill that will make about $1 million of grant money available to rural hospital transformation. Well, what do we have around here, folks? Does anyone think that it's a huge coincidence that we happen to be sponsoring a bill that makes $1 million of grant money available for rural hospitals when that's where we are right now? Does anybody else get that? Does anybody else get that? It just gets like there's just more and there's more and there's more, right? I'm going to keep going. Okay, I'm going to keep going because he also, which by the way, y'all, that bill did pass. That bill did pass. The next bill that Rusty Crow co-sponsored was SB 1227. These have all happened this year. Rusty's been a busy boy. So this one, just follow me. This one is SB 1227. And here's what it says. On and after October 1st, 2017, well, they amended it on April 16th, 2018. The House adopted Amendment 2, and it rewrites this bill, and it requires the Bureau of TennCare to promulgate rules to promote the safe and responsible coverage of opioids for TennCare members who have the TennCare pharmacy benefit. Now remember this, guys. One of Ballad's big things is we are going to help do something about the opioid problem in this region. And yet Rusty Crow is co-sponsoring legislation to promote the safe and responsible coverage of opioids for people who have TennCare pharmacy benefits. Have y'all noticed that everything that's being pushed through is TennCare and Medicaid and Medicaid expansion and all of those things? It's a lot. It's a lot, right? So again, my question is this an ethics violation for Senator Crow? And I believe that SB 994 was, I believe that SB 2048 was, and rural what was it? Rural Hospital Transformation Program, which was SB 2046. So here's what I did. I spoke with the Senate Ethics Committee this morning for quite a bit, and then I faxed them my complaint. Okay, so I'm going to give you all of that information at the end of this. Now, the thing about the Senate Ethics Committee is that you have to either fax or mail in your complaint. You can't email it. There's no online form. You have to fax or mail. Okay. So yes, and Crystal, that was the other thing that we talked about. The fact that Medicare and TennCare is involved, then that has the potential to make it criminal because you know, there we go. So here we go. I agree, Amy. All right, so keeping it moving. I did place a call to the governor's office today because I called the health department again today, and I spoke with Judy Connect. If you remember, I've talked to her in the past, and I have just flat out asked her who is John Dreisner's boss. Because for me, it's a severe conflict of interest that his wife is listed as a medical director for Ballad Health and that she has a company called Starfish Health that has a telehealth contract with Ballad. Okay, so I asked her who does he report to? Who's his boss? And she said the governor. So I just picked up the phone and I called the governor's office. And so Gary Hicks is listed for SB 2048, Ketron. Gary Hicks is listed for the House side. So if you listen, on the Senate side, it's called SB 2048. On the House side, it was called HB 2020. And if you look, HB 2020 was sponsored by Gary Hicks. SB 2048, which is what finally went through the Senate, that was sponsored by Crow. So to answer your question, yes, Gary Hicks was involved. It's a lot, okay? So I did call the governor's office today, and I talked with them for maybe 3 minutes or so at first, and just gave a little bit of the background, what my concerns were, and I talked about the commissioner, his wife, Rusty Crowe, all of that kind of stuff. And so she took my information, and within about 20 minutes, I got a phone call from Meredith at the governor's office, and we talked at great length. And she shared some of my concerns as well. So I'm going to give you guys names and numbers of people that you can contact. And I'm going to put them at the top of this live right at the very end so that you all know that you can take action. A couple of things that I really want you all to think about is we do have people that are listening, okay? People are very concerned about some of the things that we have uncovered, the way that people are connected together. I can tell you that, you know, I've had people say to me, well, what does Alan's previous position with HMA have to do with this now? And here's my only response, okay? Number one, when people show you who they are, believe them. The man was caught in a bold-faced lie on 60 Minutes on live TV, period. He denied every single allegations. He said they did not occur when he was there, that it was prior to his time. And in reality, every single bit of that was a flat-out lie. I'm not attacking him as a person. I'm simply stating the facts about his existence, his employment. And so I was asked today, well, what does that have to do with Ballad Health? Well, here's the thing. If I apply for a job, doesn't my previous employment matter to you? It's not like he was like some flunky sitting in a back office somewhere. No, he was the president of the entire Florida group. He was responsible for the operation of all the hospitals throughout Florida, and he was directly responsible for over 24 hospitals. So bottom line is, that's his professional resume, and I have every right to judge him by that and judge his performance and his ability to ethically, morally, with integrity, with compassion and kindness, and with the best interest of this community at heart. That is relevant. I don't care what else you might be doing in your personal life. Those things are relevant. Those things are factual. It's not about slamming anybody. It's not about whatever. Listen, you're the one who got caught lying on tape about that thing, not me. It was your company that has to pay $260 million for false claims on Medicaid. I don't have anything to do with that. It's not my fault that I found it. Y'all did it. So, you know, that's one of the things I want to be very clear about. These are the facts, period. Well, so here's what you need to understand. He left HMA right before the Department of Justice took over that investigation. At the time that he was there were 8 civil lawsuits against HMA, and HMA had never lost a civil suit. However, this is the first time with a civil suit that the Department of Justice stepped in and took over the investigation. And that is how they ended up with the $260 million. And it was a 3-year non-prosecutorial agreement that they entered into. That's why no one went to jail except the Carlisle, Pennsylvania office. They have pled guilty to criminal charges, and there are still pieces of this that are still under investigation, including the CEO of the company. Okay, so there you go. What else did I have down? I will tell you that I did talk to Bill Soren, who was the Bristol city manager, and I was disappointed by that conversation, frankly. What I had asked is they have a meeting tomorrow, a city council meeting here in Bristol, and I asked to be put on the agenda or to be given more than 3 minutes allotted time, because I have a lot of information that the city council needs to hear, deserves to hear, should be aware of. And what I was told by Bristol city manager today was that their first step was that they wanted to speak with Ballad Health before anyone else. They wanted to give Ballad the opportunity to explain to them their vision for this region's healthcare, not just today, but in the 6 months, 12 months, 18 and 24 months to come. And this was my response to that. And I said, well, let me just ask you something. Has Ballad Health have they contacted you before now to discuss with you the downgrading of your trauma center? Have they given you the courtesy, the professional courtesy of saying, hey, we knew we were going to make these changes a year ago, so we want to inform you guys. We want to get your opinion. We want to let you know what's happening. No, they didn't, sir. They just proceeded with what they wanted to make happen for themselves and left you all to whatever. And I said, and now you're saying you don't want to hear from the public until you hear from Ballad first. Well, did Ballad let you hear from them first? No, they didn't. They made their choices. They put stuff in the news media, and you're just left with it. So no, I don't get that. I don't understand it. And so they know nothing. Let me just tell you guys this. The Bristol City Council knows nothing other than what's been in the paper. That's it. They don't know anything. So it's just crazy. But here's my thing. When people say, well, what are their plans? You just heard an independent report talk about these plans and that they're false, that they're falsehoods, that there's no validity to them because there's no teeth to them. It's some pie in the sky. This is what we'd like to do. So this is what I said, and I've said it several times, but I also said it talking to Gary Miller today. This is what I said. These pediatric emergency rooms that you guys want to build, and you say it's because we had 20,000 pediatric ER visits between Bristol and Kingsport last year. Well, let me just tell you something. You've also said that we have very few major traumas. So, but yet you want to build a pediatric trauma unit. That makes no sense, does it? That makes absolutely no sense, because if you just said we get very few serious traumas, why the hell are we wasting money to try to build a pediatric trauma center, which finding a pediatric trauma surgeon is damn near impossible, right? It's Bristol, Tennessee, guys, Bristol, Tennessee. Like, it makes no sense. Here's what we know. The majority of those 20,000 pediatric ER visits were simply pediatric urgent care visits. We would be better off taking a percentage of that money, building 2 pediatric urgent cares that would be more easily and economically staffed, that would fulfill the need that we would have happen. We could take the rest of that money and put it into some sort of trauma center or even a level 2 or level 1 NICU somewhere in Southwest Virginia, and increasing the EMS and transport facilities that we have now. Like, that just makes more sense. Period. So those were the things that that we talked about today. Am I going to speak tomorrow? Yes, but I will tell you this, I'm going to be limited to 3 minutes like everybody else. So in 3 minutes, I'm supposed to give them enough information. So here's my plan. My plan is to go back to the store like I did before, pay to have some packets of information put together, and speak my 3 minutes, get as much of like the real pertinent stuff in that I can, and then hand the packets out to the city council and pray that that's enough. I don't really know. Okay. I do want to share with you before I go, guys, my letter today. Okay. And there are going to be people who are watching this that I know are part of Ballad, and you know, that kind of is what it is, but I'm okay with that. Here's what I'm going to tell you. For those of you guys who've asked me about verbiage, if you all are interested or need to use part of this letter and information, which it's kind of frozen right now, so hold on. Right, Tim. And so listen, when you start to look at who's on the boards, who's on the Chamber of Commerce, who's on like the COPA Council. So Gary, so let me tell you something. Gary did tell me this. There are not 7 or 8 people that are on the COPA compliance team. There's only 4 members on the team. Gary says he has 4 of them. Right. Well, Christy, I just don't know who's going to be here. So if you're in Bristol and you want to go to the city council meeting and I can give you some bullet points to cover, I'm happy to do that. I do know. So here's what we used to do, what you could do in Atlanta. Like when I was going to Atlanta for the Georgia elections, what people would do is people would sign up to speak and then they would defer their time to someone else. And there was nothing that the council could do about that. So say if 5 people said, I'm going to speak, and then when it came time for each of those people, they said, I defer my 3 minutes to Dani, then that would give me 15 minutes to talk. And I don't know that there's anything that the council could do about that. That's what used to happen when we were in, when I was in Georgia last month. So yes, Natasha. Okay, so I want to give you guys this concise information, and just pay attention to the verbiage before I go, okay? So just stick with me, okay? One of the things I'm going to encourage you all to do is stop talking about like, oh, are they building some VIP like wing in Bristol for people with a lot of money? I don't know, and I don't care. You want to know why? It's not illegal. If that's what they want to do, they can do it. It's not a violation of the COPA. It doesn't have anything to do with anything. I want us to focus on the things that actually matter. So let me ask you this. If there is anyone who has information about the number of very low birth weight babies, that is babies that are born less than 1,500 grams, in other words, less than 3.3 pounds, I need, you can only sign up for one slot, Jamie. I need those numbers. I would like to know how many very low birth weight numbers this year have been at Niswonger's Children's Hospital. I would like to know those numbers. If you have information and about, you know, a decrease in access to care, an increase in care cost, a change in somebody telling you where you can and cannot go for your care, people not giving you options for care, different things like that. I need before and after bills. I need documents where you sign about where things have to go, all of those different things, because we need to start stacking the papers to be able to back up what we're saying, okay? So I want to read this to you guys, and I just want you to hear some of this information, okay? Some of this information I really want you guys to hear. Hold on, Papa, because we're getting ready to go. Okay, so listen. This is the letter, one of the letters that I sent today. So it says, first, thank you. Yes, sir. Okay, give me 1 second and I'll get it for you. It says, first, thank you for your unbiased and speedy review of this information as it is crucial to the well-being and health care of approximately 1 million citizens in Northeast Tennessee and Southwest Virginia. In January 2018, the Tennessee State Department of Health issued a COPA to Ballad Health, the result of Mountain States Health Alliance and Wellmont Health merger, despite vehement opposition from the FTC. There are several components to this hospital merger, proposed/implemented changes to care, COPA, and its oversight that are of extreme concern to the public, as it creates a significant disadvantage in the following areas. Guys, these areas are important for you to note in all of your letters. Patient access to health care, increased cost of health care, quality of care received, and employee impact. Those things are specifically mentioned in the COPA. So when you are putting letters together, you want to make sure that you mention those things and give specific examples of how those things are being impacted by the changes that they're making. And then I listed in bullet points the foundational issues and conflicts of interest. Number one, Tennessee State Health Department Commissioner John Dreisner's wife, Jana Dreisner, has a company, Starfish LLC, that has a telehealth contract with Ballad Health. In addition, she is listed as the medical director in the psychiatry department for Dickinson County Hospital with Ballad. This is a clear conflict of interest and potential ethics violation, if not a criminal act. And then I go into the second bullet point is about Rusty Crowe sponsoring SB 2048 and the fact that I believe that this is an ethics violation as well. The third one is where I shared the shared health services that Rusty Crowe's involved with, and his extensive history also with them as well. It's funny, people start messaging me while I'm still on live. And then I listed COPA oversight concerns. These are things that you want to say in your letters, right? As COPA oversight and compliance is set up by the Tennessee State Health Department, the conflict of interest with the commissioner and his wife as a contracted employee of Ballad Health casts legitimate doubt and concern for the ability of the office to properly fulfill this duty. Gary Miller, COPA compliance, is employed by Ballad Health and therefore would also have a biased position in reporting. Larry Fitzgerald, COPA oversight appointed by the state, only works part-time on the 119 pages of requirements and commitments contained in this COPA. The ability of Mr. Fitzgerald to adequately oversee, investigate, and report on the fulfillment of the COPA is in great question, not due to his integrity or desire, but simply because of the lack of time and resources available to him to cover such a vast legal document. And then I went into closing the NICU, the downgrades of the trauma centers and so forth and so on, and moving the biologies from Allendale Treatment Center to Indian Path and what that does to increase costs. If you want access to some of these bullet points that I have put together, please let me know. Because what I'm going to do is I will give you these bullet points so that you have the verbiage that you need to be able to make these. I got it, Alicia. I will send it to you. We want to be very clear. Here's the thing, guys. If you email and you just get into a pissing match and you say Ballad Health is horrible and they're money hungry and they're awful, nobody's listening to that. No one cares. You want to know why? Because it's not documented. It's not specific complaints that show violations. There's not something that's actionable, right? So we might think that these folks suck, right? Or what they're doing suck, not them as people, but the organization and what they're doing. We might think that that sucks, right? But if you don't have actionable items that the state or the ethics committee or the consumer affairs office can look at and say, hey, we really need to be concerned about this. This does appear to have, some violations involved. They can't do anything to help us, okay? Right, we need data. So again, if you are being denied care, if your cost of care has gone up, if access to care has dwindled, if you are not being given options for care outside of Ballad Health, you need to know that as well. If you are being told you have to go to a specific facility, if you are being told or trying to be coerced into using certain pieces of Ballad's program, whether that's home health, hospice, rehab, any of those things, guys, this is important stuff because they can't do that. They have to give you choice. Okay? So listen, we gotta get down to the meat and potatoes and stop just slinging mud. We gotta stop just calling people names and saying how awful they are and whatever, right? We gotta be factual in what we're talking about because there has to be an outcome and there has to be actual actionable info that these folks can act on. So again, if you have any of those things, if your medications, your treatments have doubled, quadrupled in dollar amount, I need a before and after bill. Got it? All of those, oh Jesus, Jamie, no, do not accidentally fall. But those are the things that we need. Okay, folks, y'all got that? You're very welcome, Michelle. All right, I'm tired, my mouth is dry. My grandbaby's been up way longer past his bedtime than he should be. I'm gonna get him some juice and put him to bed. I'm going to put these numbers at the top. So this is very, very important. I'm going to leave y'all with this. Here's what has to happen. Within the next 24 to 48 hours, I need every single one of you to file a complaint with the Consumer Affairs Office. I'm going to give you the telephone number and I'm going to give you a link. When you go to the link, it's a little like, because it's a government link, but it's where you file the online complaint. You have to do that. Be specific, and you can even use attachments. So I put like just an overview, and then I included my letter as an attachment, and I included the FTC's finding as an attachment, and I even included one of the independent reports as an attachment, okay? So all of those things, I will provide the bullet points to you guys when we get off of here, okay? But so I need every single one of you. The more consumer affairs complaints that we have, they get funneled up to the Attorney General's office, and that's what will make them open the investigation. Got it? Yes, Kim. I need those cancer treatment bills. Consumer Affairs, every single one of you all who watches this video, file a complaint. And when you go to select the board, select Consumer Affairs, okay? You got to get it done in the next 24 to 48 hours, make it happen. Next, you want to contact the Tennessee Comptroller office. They have a hotline as well. Yes, I will. I will post all of it, Kim. You want to also contact the Attorney General's healthcare department as well. Those are the new numbers that I have for you guys, and I will put them up as soon as this live is over. So hopefully I gave you guys some more information that you all can actually take action on and do something. Like, I don't just want these lives to be like, holy shit, what next? I literally want you guys to say, okay, that's something new. This is now, what can we do about it? You know what I mean? So that's the end game. It's not just to talk and rant and be upset, but it's about, okay, so what do we do? What do we do now that we have this information, okay? So I appreciate you all. Y'all know how I end. I'm going to post them, okay? I'm going to post them, guys. The way that I end every single live is the same. You guys ready? Be amazing, be light, and be love. Good night. Peace.